Hello, and welcome to a new episode of the Public Health Link on this October 23rd, 2022. I'm your host, Marisa Salisbury, and we have, as usual, a jam-packed agenda. Before we get started, though, I just want to remind you, don't forget to hit subscribe. By subscribing to the Public Health Link, you'll be alerted and updated whenever a new episode is released or when a special report is released during the week. In addition, don't forget, if you have any ideas for future episodes or for new public health events, you can email thepublichealthlink@gmail.com. Again, that email is thepublichealthlink@gmail.com. So now let's talk about what we're going to talk about tonight. So for our action agenda, we're going to discuss that October 20th was World Osteoporosis Day. We're going to discuss a new One Health bill that was introduced, and we're going to talk about a shortage of veterinarians. In addition, for our Tech Corner, we're going to talk about frog robots. And for our PH event, we're actually going to discuss a mini self-paced webinar that you can take part in your own home at your own time. And we cannot forget about our pH meter. So now let's talk about community action. Welcome to the action agenda for this October 23rd, 2022 episode of the Public Health Link. So the information we're going to talk about tonight is October 20th being World Osteoporosis Day. We're going to discuss a new One Health bill that was introduced to the Senate, and we're going to talk about the concern of shortage of veterinarians. So because World Osteoporosis Day was October 20th, I don't want you to think there's nothing you can take part in, because the official day we're missing by a couple days. So I just wanted to show you before I go into it about osteoporosis and the benefits to having this awareness day. I'd want you to see the calendar that's on here. And I'm going to show you the link and how to access that calendar in just a moment. There are still events happening all over the world. As you can see, I've got Denmark up here, United States, Russia, Switzerland, Singapore. So there are events for World Osteoporosis Day that are still happening, so definitely check out the website. So, what is the point of having an awareness day? Why do we do this? We had another episode, a special report episode of the Public Health Link where we talked about rabies, a World Rabies Awareness Day. Well, what is the point of this? The point is to provide information, guidance, and action to a big audience as possible. So you have a collaborative effort from professionals and organizations that come together, like in this case on this World Osteoporosis Day website, provide information and where you can access their expertise. So it's a great way to collectively come together and disperse as much information as possible. And so World Awareness Days are fantastic to really get the word out about diseases. Some of them are very common or more common, like osteoporosis, and some are rare. It could be about rare genetic disorders. So when we're talking about World Osteoporosis Day, and again, it's on October 20th, and I want to mention it, the day before World Osteoporosis Day on the 19th is actually World Pediatric Bone and Joint Day. So apparently it's like Bone Week, which I thought was kind of interesting. So on a side note, so this actually started as a national observance in the UK in 1994. So it has since grown to, again, this is a global awareness or observation. And I want to show you why this is so important. Osteoporosis affects 1 in 3 women and 1 in 5 men. That is a huge number, right? I mean, that could be one household. That's like almost one person in every household. You have 3 people in your home. Osteoporosis can lead to fractures and various types of injuries and fragility of bones overall. And that's not good. I mean, people with severe osteoporosis could simply bump themselves or sneeze, and that could be enough to fracture. So we want to prevent that and reduce the likelihood of that disability and injury to the best of our ability. And this day helps us bring awareness to what we can do. This website does a fantastic job to talk about, how can we do that? How can we get information? What type of information is vital to reduce the likelihood of developing or the serious effects of osteoporosis? And I want to point out something I thought was kind of interesting here. Only 20% of patients will actually get diagnosed or treated for osteoporosis. So the more information we can get out, we can increase that likelihood, because we want more people with the disease to be aware of it or that's at risk. That's ideal. that you're at risk, and how can you prevent it or lessen it? Okay. So this website does a great job of going through and talking about ways that you can reduce the effects or the likelihood of getting it. And so they talk about exercise, nutrition, your lifestyle, because things like body weight and smoking or excessive drinking can also contribute to it. Risk factors, which can be genetic. This can also have a genetic component, and about testing and treatment. And I want to go back here for a moment, because on the very first page, if I go back to the top, because I'm under About Osteoporosis, if I was to hit home, it'd bring me to this page. This is the home page, okay? And I just want to show you this quiz. I'm going to click on it. What's great about quizzes like this, it's not meant to diagnose you. It's meant to help you build a dialogue with your clinician, with your medical provider. So on topics or a way you can discuss with them concerns you have, or preventative measures that you can build, a plan you can build with your provider. So I'm not going to click any answers, so it's going to tell me I'm wrong. I'm just letting you know. So if I hit start, it starts off by asking my age. And when I go through these, it'll tell me the signs. Like, have I had any of these symptoms before? It'll say, you know, if you're over 50, this is what you should do. Have you done these things? And it goes through all of, there's 10 questions total. I highly recommend for you to take a look at this website. And don't forget, the public health link always posts their links at the end of the webcast, as well as in the description underneath it. So please take these links. You know, if someone that's at risk or has questions, forward it to them. You know, send it on to them so that you can help them reduce the likelihood of either developing this or the awful effects from having osteoporosis. So our next agenda item is talking about a bill that was introduced, a One Health bill that was introduced to the Senate. And the bill is very interesting. Senator Gillibrand introduced this bill from the perspective of a biological threat. Okay, so the past week she introduced it. She's a senator from New York, and it's called the One Health Security Act. And I'm going to quote her from this. Well, we can't predict the next global biological menace. We can streamline the local, city, and federal resources at our disposal, so we're better prepared to respond to biological threats. My bill, the One Health Security Act, again, this is from Senator Gillibrand, is an important step we need to facilitate a more coordinated threat assessment system and response. One Health is a simple concept that human health is intrinsically connected to the health of animals, plants, and our environment. A One Health approach allows us to effectively address complex, multidisciplinary health problems like coronavirus, Ebola, we got food and crop diseases, and antimicrobial resistant pathogens. We must act now to strengthen our defenses and to facilitate a more coordinated response consistent with One Health principles, so that the uncontrolled spread of life-threatening diseases will once and for all be a thing of the past. Having been a part of disease response myself in the past, the coordination of services is the epitome. That communication between, it's not just from local municipalities and state, but federal, it's a constant communication going back and forth. But it's also all those non-governmental organizations or NGOs and nonprofits, the boots on the ground, that there has to be that constant coordination. So this bill I thought was very interesting and well written, because here's the bill, and I want to show you for a moment. If you scroll down to the end of that, the link for the article, there's a link right here. Discussion of the draft of the bill is available here. If I click on that, it takes you right to the draft. Now, I did arrow down right away to show you, and because this was a very important part to me to show how serious this was to really create change and assist in a One Health model. Okay, look at all of the committees that are involved. And to have these agencies and committees involved was very important. If it's only responding to this one unit in the Centers for Disease Control, then that's not comprehensive, and it definitely doesn't follow the One Health model that incorporates and really makes the most important part is the collaborative effort. No one person is the expert, and the more we understand that and try and discuss with different, whether it's different agencies, different professionals, different specialists, that's how we get a very well-rounded program and plan of how to reduce the likelihood of transmission, identify it quicker, get resources enacted faster. So this is an 18-page document, very comprehensive. I really suggest for you to read it on your own. I'm definitely not going to cover it. I've read it. It even at the very end of it, she even talks about, what the projected cost is going to be for this program. So I'm going to go back, though. I'm going to go back to that article because she summarizes, or they summarize, the writer summarizes very well the specific points of what this document covers. So there's 4 areas that they cover. They cover the importance of having a One Health Security Council. So there's that collaborative part that I was talking about and who they report to. She talks about the One Health Security Strategy. And the strategy is not just at a federal level. The communication down to the local municipalities up to a global representation, which I would say would be like the WHO or the World Health Organization. The bill discusses One Health Security and Pandemic Preparedness Network. It also discusses the One Health Security activities. What are they covering? And I do want to say there was a similar bill that was covered and submitted to the Senate. It was in March of 2021. It was called S861, S as in Sam, 861, Advancing Emergency Preparedness Through One Health Act of 2021. That approach was more so about looking at One Health from a public health standpoint. This, through Senator Gillibrand, is more talking about looking at it from a biological threat. So that one has not advanced. The one from 2021 has not advanced. It was submitted to, and there's a link on there at the end. You guys can pull it up and look at it. That has not gone past the Senate. This one is much more coming from the idea of what type of a threat disease can carry to which agencies, to, down to a local level up to the federal level. So I highly recommend for you to take a look and read for yourself. And don't forget about the action part. Reach out to your senators. Tell them what you think of it. Is there something you want to add or you think needs to be added? Tell them. They don't know unless we tell them. You need to let them know if there's something you need to change. I definitely want to underline the point of the public health link is action. We're all about action. Okay, so the last one we're going to discuss is a veterinary shortage. And this is a great article. This is regarding Alaska. And the article comes from the standpoint of tribal government, that they're talking about declaring a ongoing public health crisis. And when you talk about veterinary medicine, you might be wondering, now keep in mind, when we talk about One Health, right? That's a component of maintaining a healthy community is veterinary medicine, is animal health. So how does that impact if you have shortage of veterinarians? I would highly recommend for you read the article. They go into detail about what that crisis means to them. And there's an article link I provide to you at the end and in the description from the Atlantic from a pet owner, of what that means to not have access to emergency care for their pet. But I want to speak overall at a higher level. So here's from the AVMA, and I just want to point this out to you for a moment. This is showing the turnover rate for veterinarians versus other occupations, as well as credentialed veterinary technicians. So you can see there's multiple reasons why we have a shortage of veterinarians. And the link for this American Veterinary Medical Association article is also included in the description and at the end of this webcast. Veterinarians do everything from inspect, import, exports to taking care of zoo animals, of course, taking care of dogs and cats, inspecting farms, inspecting meat. Having a veterinary shortage is a public health crisis. If there's not enough veterinarians to inspect, the concern would be, about meat getting through that's tainted. It'd be about something being imported that could have disease. So, and think about with COVID, when we found out that there were mink that had developed or been transmitted SARS-CoV-2, right? The virus that causes COVID-19. So it's very important that we have enough veterinarians to care for all the aspects that we need within our community, from our pets to our agriculture, to our trade, like I mentioned, import and export, to wildlife, to making sure our wildlife is healthy too. And just as an interesting side note, the Bronx Zoo, there's a veterinarian there that she was the one who made the connection that when West Nile cases, before we called it West Nile, were popping up, she made the connection that it was not only being transmitted in animals, but people as well. So that was a veterinarian's role in discovering West Nile virus and the transmitting ability to animals and people. So to have a shortage of veterinarians is not a good thing. But let's talk about, just to you as a pet owner, a lack of veterinary care can ultimately mean larger veterinary bills as well. So when pets are not able to see veterinarians on a yearly basis, they can suffer from ailments and conditions that could have been prevented or lessened or caught early. With vaccinations, flea and tick products, preventative care, and of course, spay and neutering. So it not only means getting preventive care, it means catching diseases earlier, which is what keeps costs down, which we know that with us when we get sick. The earlier we catch something, then it will cost us less to treat. So what can you do for your action item? Support your local veterinary institutions, your colleges, and if you know someone who's interested in becoming a veterinarian, encourage them. Let them know how to reach out. If you're a veterinarian, mentor somebody. That's a great action item so that we can help increase the amount of veterinarians in the field. So thank you for joining me on this action agenda for the public health. Welcome to tonight's episode of the Tech Corner of the Public Health Link. So I would have never guessed that I'd be talking to you about the Tech Corner combination of frog cells and bots. Like, this never occurred to me I'd be discussing this. So these are called xenobots, and they were discovered first about 2 years ago. And the version that they just now discovered, they're calling 2.0. And it's basically an improvement. So these are living bots that are being explored to be used in everything from learning more about the human body and various diseases to ecological studies. And we're talking about tiny robots that are made from living frog cells, specifically from the African claw frog or Xenopus laevis. And yes, I had to look that up on how to pronounce that. So xenobots, and this is a quote from the article that you see here, are collections of living cells and have no brain or digestive system, but in real sense, they can be programmed to corral other cells. So as in this study, that's talked about in this article, or eventually to do other things. So far they've been used for, one of the things was various respiratory diseases, and they were used specifically for primary ciliary dyskinesia. And Dr. Blackiston, he's a senior scientist at Tufts University Allen Discovery Center. He explained, we have a number of treatments that we're investigating with xenobots, from all sorts of things, like being able to seek out a damaged spinal cord and release pro-regenerative compounds, to being able to participate in other parts of regeneration in either mammals or in humans in the future. And I was just totally, when I came across this article, I started looking to see, trying to get a better understanding. It was very interesting to hear about the combination of a computer with frog cells. I was just totally mesmerized by it. Now, I do want to say there's the other link that's provided that's from when they were first discovered two years ago. Okay, like I said, there's other links provided in the description of this video. There's a short YouTube video that talks about how they've changed them. So when they found them 2 years ago, and they created these bots that were combined with these frog cells, they were spherical. They were circular in shape. And think about when something, to corral something. So the video they show, it shows them corralling this, constantly spinning to corral cells, and it's on a petri dish. Now what they've done is, and I'm going to go back to the top for just a moment, they made a version that's more C-like shaped, and they make a great comparison. It definitely helped me for trying to visualize this. That's more like a Pac-Man. So more shaped like a C, which makes it much easier to corral cells. So if they're looking at groups of cells, or if they're looking at creating some sort of connection between cells, you want to be able to corral them as best as possible. So that's where the C shape came from. And I want to show you, because this is, whenever you talk about, of course, a new science discovery, you also need to talk about the ethical implications. These are cells. So The article talks about how to be used, and I, again, highly recommend for you to take a look at this, but I just want to go down for a moment. One of the questions that's asked in the article is, are xenobots a life form? And Dr. Blackiston says yes and no. Despite the presence of living cells, xenobots don't mean the traditional biological characteristics of a life form, like being able to produce offspring. Nevertheless, he defines them as computer-designed life forms. So when you talk about something like that, you're going to bring up ethical, implications, because one of the benefits they mention is that if it's being used to, we'll say, to get into a tight space, right, to do a part of a study, they're technically biological, so they break down. There isn't any waste involved with them. So there are definitely some ethical concerns that still should be taken into consideration. So he explains that it's something that definitely should be explored. And he's rather frank, and I was very appreciative when I read this. He said, we as scientists have a pretty tremendously terrible track record about releasing things into the environment with unforeseen consequences. When we think about animals or insects that have been released that we thought were benign, and it turned out they took over native species, or when we talk about cloning, and some cloning is good. When we've been looking into various forms of organ transplant, some isn't. And there's definite ethical concerns. So when we talk about something like this, we have to think about what are the ethical considerations that are involved. So he says that there are some potential ethical concerns with xenobots, namely how they increase the presence of AI or artificial intelligence within healthcare. He describes this growing interaction as fascinating, frightening, and promising. And he does explain, because this is a form of manipulation. These cells are being manipulated. So he compares it to the manipulation of yeast, which I thought was very interesting. So he likens it to other self-creating organisms that exist in nature and have been modified by humans, like yeast. If you drink alcohol, those yeast strains that have been used to produce your alcohol have been selected and bred and are specific strains. If you've eaten bread and there's been yeast as well in there, then there's been certainly vast amounts of selection. And every crop we have and every domesticated animal has been under the purview of some sort of human alterations for thousands of years. So this is something that, as we progress, because this is so new, I think we're going to definitely come to, more of a solid understanding of where we stand ethically. And it may be a situation where they believe it's ethical, but requires some guidance and guidelines so that we're less likely to step over a boundary that could be dangerous or result in something that's very bad that's not intended. So I highly recommend take a look at these xenobots, again, which are like a cross between a natural computer and some frog cells, and see for yourself how interesting and what the implications and what it could be used for. So thank you for joining me on this edition of the Tech Corner for the Public Health Link. So for tonight's episode of the Public Health event for the Public Health Link, I'm actually going to talk about, instead of a specific event, I'm going to bring up and discuss a self-paced webinar. So this is a public health webinar that could be obviously useful if you work at a local health department, but it could also be useful if you are a nurse in a school. It could be useful if you are a student and you would like a better understanding of the social determinants of health. If you're looking for CE credit for a public health degree or credentialing, then you can also get CE credit for this as well, the self-paced course. Before we go into the course, though, first, I want to talk about the social determinants of health for just a moment. I think it'll help you gain a better understanding of whether this self-paced course is something that you could benefit from, or even simply whether it be something you're interested in partaking. So on some past episodes of the Public Health Link, I have talked about social determinants of health, but I wanted to just bring it up for just a moment and show you a source of where you could get this information from. So again, as always, the links are provided at the end of the webcast as well as in the video description. So the social determinants of health are listed here, okay? The best way I can tell you how I look at them are these determinants help us to figure out and contribute to the well-being or health. They can also take away. So it's really, when I think of determinants, is to determine, right, to a variable of health. And they have the official definition on there, but this is how I remember and think of social determinants of health. So officially, it's the social determinants of health, or SDOH, are the conditions in the environment where people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So you can see on here, it's broken down into 6 categories: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community contact. So it's really every portion of your life, and it's really looking at what can add to or take away, your quality of life. So I'm going to click on one just to show you that if you click on this to get a much deeper, obviously, understanding, what does it do? So I'm going to click on economic stability. And it talks about not only what does this mean and why is this of concern, but it rates how well we're doing on pursuing this social determinant of health. So what are we doing to improve health through this social determinant of health? So the very first sentence tells you, in the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy food, healthcare, and housing. So you get a real quick idea of how much socioeconomic instability, of what that can mean and how that can impact health. If you can't afford healthy food, or you can't afford healthcare, or you can't afford adequate housing, what does that mean for your health? And we're talking about 1 in 10 people. Not to mention the mental stress that puts you through. It's not just the physical. We all know what we should be eating. We all know that when we don't feel well, or just simply, the type of preventive care we need, what happens if we know we can't access that? And what about adequate housing? If you're not in adequate housing, that can directly cause some issues with health, right? If you're in an area that's not ventilated properly, then you're talking about there could be respiratory. If you're in an area that has a lot of rodents, then of course that can directly impact your health. So there's lots of ways to look at of how this social determinant of health, economic stability, can directly and indirectly affect someone's health. So now that we have a little bit of a better understanding, what a social determinant of health is, now let's go to the webinar. So this is, again, it's self-paced. I'm going to go all the way down here so you can see the modules. So there's 6 modules in total. When you click on it, if you have not registered for an account, it's going to tell you at that point you do. There's no fee. There's no fee whatsoever to do this, but it'll prompt you to create an account. And to get the CE, and they explain this here, if you're looking for CE, you have to complete all 6 modules. What was really interesting about this is the case studies. I am the type of person that I don't want someone talking at me, which is why the public health link is about action. Okay, so here's some information. What can you do with it? How can you apply it? I don't want to talk at you no more than I want to be talked at. So this is a great way to have case studies. It makes it more interactive so that it's not just about learning the material, it's about how do you apply it. And again, if you're in public health, you work for a local health department, if you're a nurse in a school, if this is the first time you've heard of social determinants of health and you want a greater understanding, if you are thinking about going to school for public health, even just slightly thinking about it, this would be a great way to get your feet wet and see, well, what's involved with this? Because I can tell you, whether you're in public health or One Health, all of these have some aspect of what you do. For instance, one of the things we want to obviously avoid is stigma or marginalizing people. So if I understand what someone may be going through, I'm less likely to do that, right? So it's important to have a greater understanding of the community you're working in, or the niche, or the environment you're working in, so that we can hopefully improve the quality of life of those around us. So thank you for joining me on this public health event. I hope that you check it out and that you definitely participate and get the CE for this self-paced webinar. And don't forget, if you have any ideas for public health events or topics, don't forget you can email thepublichealthlink@gmail.com. Again, thepublichealthlink@gmail.com. Thank you for joining me. Welcome to the Public Health Meter, or PH Meter, segment of tonight's Public Health Link. So the PH Meter event, or I should say topic, tonight is really about how to get involved in Milwaukee. It's a specific event that they're having to get people more involved in planning for public health services within their community. Before I actually talk about the article that we're going to use specifically for the pH meter, I want to talk about being involved for just a minute through community input for public health. Okay. So there's something called CHNAs, or Community Health Needs Assessments. Sometimes they're also called Community Health Assessments, or CHAs. And it's a way for a community organization. So it can be a health department, it can be a hospital, it can be a tribal government. It's a way for an organization or entity to take a look at a community and see whether they're meeting the needs. And it's very comprehensive. Okay, so it looks at workplaces, places of worship, socioeconomic status, education, and then they take direct input from people of, what areas do you think we need to improve upon, and what direction do you think we should go? Sometimes they're yearly. This one's every 2 years, and this is the example I'm going to show you is for Spectrum, from Spectrum Hospital in Michigan. But they can be yearly, they can be every 2 years, but it's really important way for hospital systems, like I said, health departments, tribal governments, municipalities, to look at social determinants of health. So remember what we just talked about for our public health event, and see whether they're meeting all of those spaces to keep people healthy. So whether they're meeting, remember they even talked about built and social determinants of health, built places, so that could even be like parks, whether there's any improvements that need to be made to encourage health within a community. So they're taking a look at really the services they offer. It could be equipment that's available. It could be exercise spaces. Sometimes, especially those that are the CHNAs that are in the city areas, they'll look at whether street lighting is affecting people wanting to go out and walk. That's how specific and how comprehensive a CHNA can get. So this specific one, I just want to show you. Now this one's 76 pages. I've seen them well over 200 pages before. It really depends on the entity. I just want to give you an idea of what you can see in them. So this one's covering portions of 3 counties in Michigan: Berrien County, Van Buren, and Cass. And you can see that they divided up among zip code, and they have demographic information. And if I keep scrolling, I'm going to see a little bit of everything in here. And including, you'll even see a spot that says about museums, like right here, listening tours. They really trying to get an idea, because even things that don't directly impact our health, physical health, can impact our mental health. Knowing what things that we have access to or that we can afford can affect our health. So it's really, like I said, it's a comprehensive assessment. And I want to go down to something particular because keep in mind that the public health link is about action, and specifically the pH meter is looking at something that encourages action. Remember, so if I go through something and I say, oh, this is very acidic, that means it's encouraging you to do nothing. If I'm seeing it's very alkaline, that means that it's encouraging you to do something. You've got this information and you feel like you have to run with it. If it's a 7 on that pH meter, that means it's information only, and it's not a bad thing. It's just, it could be a starting point or foundational information. But the more action with the public health link, the better. What I want to go down to is page 42, because I want you to see how involvement in these CHNAs can actually take part, because you're going to see a segment of this through Milwaukee, okay, through the point of tonight's public health meter. Here's a statement. So this was a section that was talking about priority health needs safety. And like I mentioned to you, that they can include whether there's enough streetlights, as a measure that needs to be improved upon. Because think about it, especially in areas where we get cold, right? In Michigan, it can get dark before 6 o'clock in the wintertime. So if there isn't streetlights available, are you going to go for a walk? Probably not. So those types of things can impact health. Some things are directly, some are indirectly. So in this particular section where it says priority health needs safety, there's a part that says education, awareness, and action. And this is a quote from somebody within that community. Teens do not think they are going to live past 20. Friends died from bullets. Part of why they do not plan for future is because they cannot think beyond survival. If I make it to 20, I will be lucky. Now think about how important that statement from somebody is in determining what is preventing someone from either attaining health or maintaining health. They obviously do not feel safe, obviously, by questioning the fact of living to be to 20. So CHNAs are an incredible important tool in looking at a community, boots on the ground level of whether needs are being met, whether the services being offered at a hospital, whether mental health services being offered through some sort of community organization, whether those are actually meeting the needs of the community. So keeping that in mind, and understanding that, yes, these are things that are done on a regular basis. And I have to tell you, if you are watching this and you've never heard of CHNAs and you thought, well, I would really like to take part in this with my local health department, call them. Call your local health department and ask them who does your CHNA for your community. They will tell you how it works usually it's random calls, but they can explain to you how it works and how you may get involved. Hospital systems like with Spectrum, they do them. That would be another option to call and see how you can get involved in. But your voice counts, especially when it comes to public health planning. So for tonight's public health meter, when you're thinking about creating a document like this, a comprehensive document, right? Milwaukee is doing something that is really trying to encourage on multiple levels input. They're having in-person meetings, Zoom meetings, and they're trying to get people to talk about what they need. Where is it they see their communities going? What can the health department do to meet those needs? So Milwaukee is looking at what programs they need to implement or maintain for the next 5 years. So this one's a 5-year program. And they're looking for feedback. Quote, this is a quote from the article you see in front of you. You cannot really improve the health of an entire population if you're not closing the gaps and improving the health of those who have the most need. The partnership is a nonprofit organization that aims to connect Milwaukee residents with services. So they're getting input from community members, from organizations, and that's how CHNAs work too. They'll get input from doctors that will say, we have a concern here. My patients, a lot of my patients, 50% of my patients don't have health insurance. So the services that the hospital offers is out of reach for them. They can't afford that. And you'll see CHNAs where the doctors are giving us, it's anonymous. And they're saying the hospital can't meet the need because a large percentage of my patients don't have medical coverage. So you're getting input from all these professionals, from community members, organizations, and seeing what you need to do to meet the needs of the community. So the director of the health strategy for Milwaukee Health Department explained, I think there's always going to be a need for improvement and always going to be gaps that need to be filled. But he argued that this is what's important about this event. It allows us to think about how we are being responsible. And he explains in it that possible priorities can include a wide variety of issues ranging from things like drug use, exercise, immunizations, even to things like improving parks, healthcare access, educational opportunities, food affordability, and even reliable Wi-Fi. When I think about, it's like with this, right? Let me go back to that CHNA for a minute. Where else would I find this 76-page document but online? So if I don't have access to it, I may not even know it exists. And this may be even the first time you're hearing about it. So Wi-Fi is an incredibly important tool. Look how the public health link is getting information to you through internet, right? It's either probably through your internet service provider or your cell phone that you're watching this with me today. So I'm going to go back to this for a moment. So the article explains that this is a way for Milwaukee County Health Department to get their community members involved, and they want them to show up to meetings. They want them to be part of Zoom processes or those virtual meetings so that they can provide input. And I want to tell you, I'm going to go back down here for a moment. There is still another meeting left. So if I click on here, it says for those interested in attending feedback session, registration can be found. If I click on it where it says here, it will take me to a registration link. And as you can see, so today again is the October 23rd edition of the Public Health Link. There's still one more session left, and it's on November 1st, and it's a virtual meeting. It's a Zoom. If I click on this, I can register. So seriously think about the fact of, how can you be more part of being a part of help your community planning? If you're seeing something that you think, boy, this is just not working, maybe look at your community, look at what's preventing you maybe from taking part in some sort of activity, or maybe there's some additional information or sources that you want to have more available. Maybe there's some needs that need to be met that you know of in your community for drug treatment, for community mental health. Those are things that they need to be aware of so they can meet those needs of the community. So I was very impressed with how Milwaukee is trying to reach people on all different levels. And like I said, if you look here, they've had 4 meetings. Will be the 4th meeting on the 1st. And I like how they varied the times for it. They varied the locations for libraries, again, Zoom, the school. They varied the times, the locations. They're trying to get people involved in all different levels to take part and help plan health for their community. So here's my pH meter, right? So here's my pH meter. And again, remember, if I say something is acidic, that means it's like it encourages you to do nothing. Like you read it and you're like, I don't care one way or the other. I definitely don't aim for that with the Public Health Link. I'm hoping, I want something to be alkaline. I want something that's encouraging you to do something, like at least tell somebody or take part or seek it out within your community. If I say it's a 7, that means it's neutral and it's information. It's not good, it's not bad. It could be foundational. Start somewhere, right? We all start somewhere. So it could be on an informational basis. So for tonight's public health meter, in regards to this fantastic program by the Milwaukee Health Department to get more people involved, I'm actually given an 8.5. And the reason why I said 8.5 with it was I wish there's another way more people can be involved on a different level. I know it's for the community, for Milwaukee. But the other part of it was I would have liked a little bit more information to see, because they had talked about they had done a past report so that people can see where the information, worked. How did it work with collecting it from the past? So that was really the only reason why it wasn't a 9, was I'd like to see the past report. I think when people can directly see the contribution, it's like, see, if I go back to that CHNA and I show you again that page 42, where that was a real statement someone said, that motivates people, to want to get involved. So I just wish they would have had a little bit more information about the past report. But so tonight's public health meter, I gave it an 8.5. Thank you so much for joining me. And don't forget to look to see how you can get involved. Talk to your local health departments, your hospitals, your tribal government, and see how you can contribute to those CHNAs or those community health needs assessments. Thank you for joining me tonight on tonight's public health meter. On tonight's episode of the Public Health Link on October 23rd, 2022, we covered a lot of information. We talked about October 20th being World Osteoporosis Day. We discussed a bill brought forth to the U.S. Senate by Senator Gillibrand that covers One Health. And we talked about a veterinary shortage. For our tech corner, we talked about robotic frogs. And for upcoming pH event, we discuss a webinar that you can take part at home on your own time that's self-paced. And we can't forget about the pH meter, where we discussed a way in Milwaukee to be part of the public health planning in your community. The Public Health Link is all about what you can do with the information. Knowledge is nothing if we don't share it with others. So my hope is always that you take the information here and you talk to your friends, your coworkers, your neighbors about it. If there's something someone that you think of that could benefit from it, share this information. And of course, recommend watching the Public Health Link to them as well. I would highly recommend for you to subscribe to the Public Health Link. Why? Because as we add new episodes, or if there's special reports that are added during the week, you'll be alerted when they're added to this YouTube channel of the Public Health Link. In addition, don't forget, if you have any ideas for future episodes, or maybe there's a public health event you know that's coming up, don't hesitate to reach out and let us know. You can email us at thepublichealthlink@gmail.com. Again, that email address is thepublichealthlink@gmail.com. So as I end tonight's episode, I have one last question for you. How can you contribute to the health of your community? This is Marisa Salisbury signing off on tonight's episode of the Public Health Link on October 23rd, 2022. And I look forward to seeing you next weekend on the Public Health Link.